Okay, I'm Dr. Preeti. I'm a radiologist here in Apollo Cradle Royale, and I'm working since 4 to 5 years now here in Apollo Cradle. It's a long story actually. My father, he's a doctor. He's an Ayurvedic doctor, and he's too much into his, medical field. So he always wanted me to become a doctor, and after seeing him, helping others for his patients. So since childhood, for me it was like I have to become a doctor. I could not see myself anything other than doctor. And we as 3 sisters and 1 brother, we all are doctors now. Because my father was like, doctor is the best profession you can do, and you can do something for other people. See, especially I'm doing the obstetric and gynec ultrasounds. So when I had to decide, so when my result came, I was the topper of the entrance. So there was a big fight in our house. My father-in-law, he said you have to become a gynecologist. My mother-in-law, who is a gynecologist, she wanted me to become a radiologist. so it was a fight going on whole day because next day was a counseling. So then my mother-in-law told me, see, if you become a radiologist, you can see things before other people can see. And being in now obstetric ultrasounds, I can make out that smile on parents when I tell them, okay, the first scan of pregnancy, you are pregnant. I show them baby's heartbeat, baby's growing, baby's 3D pictures. I can feel that happiness. So that is why I'm a happy radiologist today. I'm in radiology maybe now 10 to 12 years now. I was working in a government hospital. It's Maulana Azad Medical College when I did my senior residency. Yes, radiology is now like very vast. You have to choose what part of the radiology you want to do, whether you want to do MRI, CT scan, or you want to be an ultrasonologist in radiology. So earlier those days it was one radiologist who was doing everything, but now you have to be very specialized. Whatever you are doing, anything, you have to be the best. So that is the progression. Of course, now machines are too good. Earlier we used to struggle to take 3D pictures. Now it's like one click and baby is in front of you, parents, and makes you happy. Mostly they come here, okay doctor, we have to go for a shopping. I'm going US, I'm going UK. Please tell me what is the gender. But Indian law about this thing is very strict, and if I'm an Indian, I'm staying in India, I have to, keep that laws in direction. So, sorry to everyone. I know some people, they just want to do shopping, they're more crazy about. But yes, Indian scenario has some bitter truth also. Some people, don't want girl child. So to protect that thing, we have to ignore that maybe 20, 30, 50, maybe 60% people's wishes, because we have to save those 30% or 40% girl child. My kids are very small. My daughter is just 9 years, son is now 5 years. So of course family was very worried. They are worried. In morning, when I come here, in whole of my family, we all are doctors. And in the evening, every day discussion is was any exposure to you during this day? My brother, he's posted in COVID ward. He's in Ludhiana, he's doing his post-graduation. Every other day, his friends are positive, becoming positive. Today, his test result has to come. So you can understand that worry. My sister already is COVID positive last month. So out of 4 brother and sisters, 1 is waiting, 1 is already COVID positive, and 2 are left. So fingers crossed that we are safe and our family will be safe and forever from this deadly virus. I just want to tell them, this shall go past. I want to give message to other people, the patients. Just be soft with doctors. You don't know how much stress they are having when they are sitting on this chair or they're doing their duties. You can't just, expect them, the doctor, to be like, that happy, that smiley face every time when you are in PP kit. I'll tell you one story. I was sitting in PP. I was waiting for one. It was since 3-4 hours already. I was in PP. I could not breathe. One patient came. She was a pregnant patient. I asked her, please give me your prescription. Please give me your old forms and old reports, everything. And every time her answer was, I forgot. मेरा घर पे रह गया. And then I was sitting in extra half an hour for in PP. And she was just sitting outside having her coffee, everything. Because her husband again went to home to collect everything, all reports. And when she came into the room, I just told her, for me, it's my sort of majboori, I'm sitting there. Why are you sitting half an hour extra in this hospital? Even hospitals are the most, source of infection these days. And then next day she put something on this social media that doctor was so rude to me. They don't know how to talk with patient. So I just want to tell patients, just wear that PP kit for half an hour and then wait for doctor for half an hour. So okay, doctor will come, then that doctor will do your ultrasound or anything. Then you will understand that it is so much of trauma when you're sitting in that PP kit and you can't breathe. So just be soft with them. They need your love at this time.